The first question is for Kari. The question is, are the tools being discussed available for replication? Specifically, will the healthy weight plan for the school setting be available?
Yeah, I think that's on our website currently, and if it's not, you can email me and I'd be glad to send it. With the school, we created a healthy weight plan for general use that has been offered to the broad school community in many schools. In some cases, the principal sent out a letter offering that to be completed. And then we've also created an obesity-focused individual health plan, like the school nurses implement for kids that have asthma or diabetes or those types of things. This one is focused on obesity, and it, again, aligns with the 5210 message, and it sort of dictates the workflows that our nurses follow when they work with a patient or a student that has obesity. And they're encouraged to work with 6 to 8 students per school that are obese. So, but yes, we are happy to share anything that we have created and are using. And if it's not on the website, please feel free to email me.
Thank you, Kari. The next question is for Shayla. Could you share where we can find evaluation data for the 521 approach? We would like to know where to find evidence that this approach is effective.
Yeah, so thanks for that question. That was exactly the question that all of the 10 teams at the table for our very first Healthy Weight Collaborative activity. We had several of the NICHQ and the HRSA expertise at the table, and a binder of an incredible amount of resources and background that was looked into. So I'm wondering if some of that material, maybe NICHQ, can comment if that's available for public access, because a lot of that was vetted before we even arrived, looking at messaging and effectiveness of messaging, not just 5210, but like there's a clock program in Chicago that has a messaging as well, and many of these programs, the one in Maine that we chose, has done some local research, not on a national level, that we saw 2 years ago when we were looking and reviewing at which messaging had the best data to support its effectiveness, and also how easy was it to implement in our own community. So we considered those factors, and what we saw in the evidence for 5210 specifically was that if the families that were surveyed, they did, and they've published it, and I can forward the references that I recall reading 2 published studies on. One was regarding the effectiveness of reaching families with the messaging, and could they recall it. So that's just a recalling ability of being exposed to the message, not an assessment of behavior change. And what they found was that if the families were exposed in more than one setting, so school and the business or in their doctor's office, so 2 settings, the likelihood of their recall was much higher. And then the second one, which I think we're more apt to be interested in, is not just that they can recall the message, but does it in fact lead to behavior change, which has been, I think, lacking in the evidence at that time. There was really a paucity of material that we could see that really demonstrated behavior change as a result of the messaging, but there was a small study that they did show us that showed, and I'm recalling now, and I might be wrong, but I'm thinking that there was behavior change in consumption of fruits and vegetables in people that were able to recall the message more clearly, and perhaps a little bit higher physical activity level. So I would have to forward those references for you, but there was a small amount of data at, again, like I said, the local level, nothing at kind of this national level at that time, and maybe we've moved forward on more evidence behind these messaging efforts since that time.
Thank you so much, Shayla. The next question is for Dr. Linda. How does the Healthy Weight Collaborative align with other federal initiatives?
Well, the Healthy Weight Collaborative from the start was designed with other federal initiatives in mind, and it was designed to be complementary to work going on at CDC, and that's probably the primary agency that has significant obesity initiatives. Of course, we also aligned it with the First Lady's Let's Move initiative, and throughout the collaborative, in addition to the teams that you've heard from today, we've had lots of partners and stakeholders. So partners within the Federal Department of Health and Human Services, from other federal departments, and with numerous outside stakeholders. And for example, we've had a representative from the Let's Move initiative with us in the various meetings and planning. So what distinguishes this collaborative is the focus on bringing together the primary care, public health, and the community using the evidence base, and then testing it through the breakthrough series model, revising things, and then moving on. And then, of course, the scale up and sustainability beyond that.